Discover the power of breathwork. Breathe your way to a better life. Doctor explains the life-changing benefits and side effects of conscious breathing by Dr. Anaya Mehta, MD, pulmonary specialist and integrative health advocate. Take a deep breath. Feel your lungs expand. Feel your heart beat gently in your chest. You've just initiated one of the most powerful healing mechanisms built into your body: your breath. Welcome to a journey into breathwork, a practice so ancient it predates language, yet so potent that modern science is only beginning to grasp its full potential. As a doctor who has spent over 2 decades studying the respiratory system and its impact on physical and emotional health, I've seen countless patients transform their lives through the simple, mindful act of breathing. In this guide, we'll explore what breathwork really is, the medical science behind it, techniques you can start today, life-changing benefits, potential side effects and cautions, and most importantly, how to make it part of your daily life. This is more than a health trend. It's a return to yourself. Chapter 1. What is breathwork? Breathwork is the conscious control and manipulation of your breathing pattern. Unlike the automatic, unconscious breathing we do daily called basal respiration, breathwork asks you to take the reins, to breathe with purpose. There are many forms of breathwork: box breathing, square breathing, hold, exhale, hold, each for equal counts. A calming yogic practice that balances brain hemispheres. Holotropic breathwork, a therapeutic, rapid breathing technique for emotional release. 4-7-8 breathing, a method for calming anxiety and improving sleep. Wim Hof method, involves deep, rhythmic inhales followed by breath retention and cold exposure. Breath holds, short, slow, cool, deep, 400, 10 times. The science behind the breath. Breath is not just a function, it is a regulator. The autonomic nervous system. Your breathing is deeply tied to your autonomic nervous system, ANS, which governs your fight or flight and rest and digest, parasympathetic, responses. Through breath, you can shift your body out of stress and into calm. Oxygen and carbon dioxide exchange. Deep, conscious breathing improves oxygen delivery to cells and facilitates better removal of carbon dioxide, a waste product. This enhances energy, clarity, and immune function. Vagus nerve activation. Certain breathwork styles stimulate the vagus nerve, improving digestion, lowering heart rate, and calming the mind. Brainwave changes. Breathwork can influence brainwave states, shifting you from beta or alpha or even theta, deep relaxation or meditative states. Let me be very clear. Backed by science and experience, let me be very clear as a physician. There is no pill that can do what conscious breathing does, and yet it's free, accessible, and always available. Here's what the research and years of patient outcomes tell us. 1. Reduces stress and anxiety. Breathwork lowers cortisol levels and balances adrenaline. A 2017 study published in Frontiers in Psychology found that even 5 minutes of deep breathing significantly reduces stress. 2. Improves sleep quality. Techniques like 4-7-8 breathing activate the parasympathetic nervous system, promoting deeper, more restorative sleep. Patients with insomnia often report improvement within weeks. 3. Boosts immunity. Chronic stress weakens the immune system. Breathwork enhances lymphatic circulation and oxygenates tissues, improving resistance to infection. 4. Enhances mental clarity and focus. By increasing oxygen to the brain, breathwork sharpens cognition. It's why Navy SEALs use box breathing before high-stakes missions. 5. Supports cardiovascular health. Slow, controlled breathing reduces blood pressure, improves heart rate variability, and can lower risk of cardiac events. 6. Increases energy and stamina. Many athletes incorporate breath control, like Wim Hof or pranayama, to increase VO2 max, stamina, and recovery speed. 7. Unlocks emotional release. Holotropic and connected breathing techniques can bring long-buried emotions to the surface for healing. Many trauma therapists integrate breathwork into treatment. 8. Deepens meditation and self-connection. Breath is the anchor of every meditative tradition. It helps quiet the mind, enhances mindfulness, and allows for a return to the present moment. Doctor's step-by-step breathwork routine. You don't need hours or special equipment. Just a quiet space, a few minutes, and your attention. Beginner's daily breath practice. 10 minutes total. Morning, 5 minutes. Breathing inhale for 4 counts, hold for 4 counts, exhale for 4 counts, hold for 4 counts, repeat for 5 minutes. Night, 5 minutes, calming 4-7-8. Breathing inhale through the nose for 4 seconds, hold the breath for 7 seconds, exhale slowly through the mouth for 8 seconds. Repeat for 5 minutes before bed. Repeat this sequence daily for 21 days to form a lasting habit. You'll begin to feel the shift within the first week. Side effects and cautions. As with any powerful tool, breathwork must be used responsibly. Short-term side effects, typically mild and temporary. Dizziness or lightheadedness, common in hyperventilation techniques. Always sit or lie down. Emotional flooding. Breathwork can unlock repressed emotions. This is therapeutic, but may feel intense. Tingling in hands/feet, due to shifts in carbon dioxide. Usually harmless. Chest tightness or tears may occur with trauma release breathwork. Stop if it feels overwhelming. Who should be cautious? People with epilepsy. Certain breath techniques may trigger seizures. Pregnant women should consult a trained instructor before practicing. Individuals with heart conditions avoid hyperventilation-based methods unless medically cleared. Severe anxiety/panic disorders. Breathwork is healing, but guided sessions are advised to avoid triggering panic. As a doctor, I strongly advise starting slowly and never forcing the breath. If a sensation feels alarming, simply return to natural breathing and consult a breathwork professional or physician. Exercises to integrate breathwork into daily life. Here's how to weave it into your everyday routine. Before meetings, 1-minute box breathing to stay focused. During commute, diaphragmatic breathing to stay calm. Post-work, 4-7-8 breathing to transition out of stress mode. Before sleep, gentle nostril breathing for better rest. In arguments, pause and take 3 deep breaths to regulate emotion. You can also use breath reminders on your phone, or apps like Insight Timer and Breathwork to stay consistent. Patient stories. Case 1. Maya, 38. Anxiety and sleep issues after a stressful divorce. Maya struggled with anxiety and insomnia. Prescription medications made her groggy. I introduced her to nightly 4-7-8 breathing and morning energizing breaths. In 3 weeks, her sleep normalized and her anxiety scores dropped by 60%. Case 2. David, 54. High blood pressure. David was on 2 antihypertensives. We added daily diaphragmatic breathing and heart coherence breathwork. After 2 months, his systolic pressure dropped by 12 points. 1 medication was eventually reduced. Case 3. Lila, 27, trauma survivor Lila, used somatic breathwork during her therapy sessions to access and release long-held grief. She describes breathwork as the moment I felt safe in my body again. The spiritual dimension, optional but profound, across cultures and centuries, from the yogis of India to the shamans of South America, breath is seen as life force. In Sanskrit, it's called prana. In Chinese medicine, it's qi. In Latin, spiritus. Whether or not you consider yourself spiritual, you may find breathwork bringing you into greater alignment with your body, intuition, and even purpose. Chapter 9. Tools, Resources, and Support. Recommended books. Breath, by James Nestor. The Healing Power of the Breath, by Richard Brown, MD. Just Breathe, by Dan Brule. Apps. Insight Timer. Breath Rank, Calm Breathe Plus. Search for trauma-informed or therapeutic breath coaches. Always ensure instructors have credentials in holistic therapy or respiratory training. Chapter 10. Final Words from a Doctor. I've seen breathwork help patients wean off anti-anxiety medications, restore peace after trauma, sleep without sedatives, perform better under pressure, and rediscover joy in their bodies. The secret was not in an expensive treatment or a breakthrough pill. The secret was within them all along. It's in you too. So I invite you now. Close your eyes. Place a hand on your heart. Take a slow, deep inhale. Takeaway: you don't need to change your whole life, just how you breathe.